Hey guys, I'm Charlotte Moore.
And I'm Christina. Welcome to our Facebook Live with GBMC Healthcare. Today we're talking about the world's most accessible sport, running.
And I love to run. So
Me
do you,
too.
Christina. This is so exciting. We're getting expert advice on how to avoid injuries and when it could be time to see a doctor. We're also answering your questions throughout our conversation. So please comment below this Facebook Live and ask any questions you may have.
Yes, let's welcome our guest, Dr. Todd Melegari, orthopedic surgeon with GBMC Healthcare. Welcome.
Welcome, doctor. How you doing?
Great. Thanks for having me. I'm glad to be here.
Of course, we're excited to talk about this. I know there are a lot of runners tuning in, so hopefully you have a lot of questions. Send them our way. We love to hear from you. So let's get right into it. Do you see a lot of runners?
Of course. It's very common. As you said, it's a very accessible sport, so lots of people participate, and inevitably a lot of people get injured and have issues and then find their way to us.
Yeah. Right. Speaking of issues, what's the main reason runners come to you?
So the main reason runners come to me is the main reason most people do. It's because they can't do something that they want to do. So in terms of runners, it could be somebody who's just starting to run and they feel like they can't progress the way that they want, or it can be somebody who's run for a long time and had a specific routine, and for some reason they can't continue with the routine that they're used to, and then they become frustrated, and then that's when we see them.
Yeah, I definitely understand that frustration.
Exactly. Can people run too much?
So yeah, I mean, my opinion is that, running honestly is like anything. I mean, it's good in moderation. The key thing with running is taking a little bit of time off, days off or rest days. When we run, we're actually injuring or causing micro trauma to our tissues, our muscles. And those off days are vitally important so that your body can repair and restore and rebuild. And ultimately, that's how you get stronger. And when you have that off day and that process occurs, then when you come back the next time, then you can do more and go further. If you don't have those rest days or take that time off, then those micro trauma injuries can pile up and ultimately things can break down and then you can run into trouble.
And we'll have to come see you.
Yep.
Are there particular body parts that you'd say are most affected by running? I mean, I'm assuming our ankles, our feet, what else?
Yeah, so in general, yes, it's lower extremities. The main common complaint people have is knee problems. Now, generally, again, the knee problems people run into from running have to do with overuse. That can involve the kneecap. If we take the kneecap and we flip it over, the backside of the kneecap has cartilage. It's a lining. I tell people it's like the tread on a tire. It can become irritated, okay, and then it can become painful, and then it hurts to bend your knee, it hurts to squat. There's also tendons that connect your kneecap to the muscles in your thigh as well as down to your shin bone. And if those tendons get overused, then they become inflamed and painful, and then all of a sudden the simple things you take for granted every day beyond running, just walking up and down the stairs, they can become a problem, and then ultimately you find your way to your doctor.
Ouch. Yeah, we don't want that.
We don't. We want to take our rest days.
Exactly.
We want to make sure that we can still do our
balance, you know what I mean, and really take care of yourself. Yeah. So that's why it's also very important to stretch, right, doctor?
Yeah,
absolutely.
Talk to us about
that. Yeah. Stretching is vitally important. Ultimately, stretching helps to maintain flexibility and strength in your tissues, your muscles, and your tendons. And if we don't stretch, then ultimately the muscles become short and they become tight. And then when you go to do an activity such as running, and those muscles get a workout, they get stretched, they can't stretch as much. And then that's when you run into the possibility of these overuse injuries that ultimately cause limitations and pain.
Should we stretch after our workout? Do you recommend that?
Yeah, so that's a great question. There's actually a lot of debate about what type of stretching, when should I stretch, before and after. And when we're talking about that, trying to answer that question, I think it's important that we specify there are different types of stretching. I kind of like to break it down into two types of stretching: static stretching and dynamic stretching. When I say dynamic stretching, what I'm talking about is stretching that occurs while you're doing something, while your body's in motion. Okay? You take your joints and your muscles through a range of motion, and you warm. That's best for when you're warming up, because you're preparing those muscles and those joints for what's about to come. You're getting them all engaged and getting that process working. And contrast that with static stretching. Static stretching is stretching that occurs basically when you take one muscle group and you hold it in a position.
So like just holding this
exactly.
Would be a static stretch.
Exactly. And you hold it there for 30 to 60 seconds. And ultimately that's helping to increase flexibility. And what we know is that your muscles are most pliable and flexible after they've been through a workout, such as when you're done running. So I typically say the dynamic stretching before you run and then the static stretching after you run. Now, I mean, that's no magic to it. There aren't any hard and fast rules. And if you're somebody who's been running your whole life and you do static stretching before you run, I mean, I'm not saying that you should stop doing that or anything, but that, like I said, it's certainly something that people have put a lot of effort and research into to try to figure out what's the best. And you know, like I said, there's not a concrete answer, but that's generally my thoughts on the subject.
Sure. I have a visual of the Olympians doing like the big jumps and high knees right before they get ready to go.
Exactly. That's exactly the things we're talking about. Just leg swinging, you know, you stand next to a wall and brace yourself, and the leg far away from the wall, you just swing it back and forward, and then lunges, and like you said, the high stepping things. And you know, you oftentimes even see, if you watch, you know, sport like football, you oftentimes see the football players, they'll do a little bit of both. They'll do some static stuff, but then they'll do the high leg kicks and things of that nature. So
get the blood pumping.
Yeah.
Oh, this is awesome. So let's talk about the importance. We've mentioned it, having a rest day. We need to take that time. We need to regenerate. Is there anything that we can be doing on that rest day so that we still can be progressing?
Yeah, that's a great question. And when we talk about, you know, a running routine, somebody's interested in starting a running program or building up to something like a marathon. So part of that process is a rest day. What you can do on your rest day, you know, we use the term cross-training loosely, and what basically that means is you're doing something that's going to give you a workout, but it's not running. So that could be something like swimming, riding a bike. You're obviously getting a good workout doing those things, but you're using different muscle groups in different ways. So you're keeping up with, you know, keeping yourself in shape, but at the same time, you're letting those tissues and muscles and things that are important for running maybe get a little bit of a rest.
And still feel productive.
Yes.
We have some love right now from our Facebook.
Yes, thank you, Kathleen, for that like.
Yeah.
And we had a comment from Lisa. She's not really a runner. Are some of the things that we're saying going to also apply to people who are just regular walkers? Maybe they're doing speed walking. Maybe they're just casually walking around the neighborhood.
Yeah,
Still important?
Absolutely. I mean, I think the general principles are the same. I mean, you want to give your body a chance to warm up, and you want to decrease your chance of injury. And so whatever type of activity you're involved in, it's very important to just not focus, you know, specifically on the activity, go do it and be done with it. And all these things we were talking about are applicable.
So I know a lot of runners that run every single day. So can you actually run every single day without an injury?
You know, honestly, my opinion is that's probably not the best thing to do. I mean, can you get away with it? You know, sure. But I think what you're doing is you're just kind of towing the line there. And if you're not giving your body that chance, that rest day to recuperate, you're just increasing your risk of having some type of problem, whether or not it's, you know, a lingering tendinitis, or, you know, a worst case scenario, you develop something like a stress fracture. And those are the types of things that can really slow you down. Yeah. So like I said, in general, you can get away with it, but I wouldn't recommend it.
What would you recommend for somebody who's training for a long distance race?
Yeah, on the very extreme end of the running
So there's a lot of things to think about if that's the direction you're heading. I think first and foremost, when you're training, you need to listen to your body. And what I mean when I say that is, if you're having issues, you're having pain, you have to be cognizant of that. And if it's pain that is okay pain, which actually does exist, it's something that should get better if you treat it appropriately. If you have a rest day, or you use something simple like anti-inflammatory medicine or ice, then those simple things should get better. If they don't get better, then that's when you might want to think about, gee, maybe something more is going on here. Sure. And now the other things in terms of a running program to build up to a marathon, you want to have a plan. You want to, you know, have a set way that you're going about it, whether it's, you know, how many days a week you're going to run, how far you're going to run those days. And honestly, you know, everybody's a little different, so there's not a right or wrong answer as to what that program should look like. A lot of people belong to gyms and different things and have trainers there who are terrific resources in terms of coming up with those types of plans. And then we also talked before about the importance of building a cross-training aspect into that program. So that's another thing you want to think about if you're building up to, you know, a half marathon or whatever, or a full marathon.
Definitely. So you mentioned good pain. What do you mean by good pain? Is that just like muscle soreness?
Basically, yes.
Okay.
I mean, typically, you know, your muscles are acting, they're burning, you know, lactic acids, you know, building up, and that can cause discomfort. So, like I said, the key thing is does it get better? You know, you have your off day. Does it go away? Do you treat it with ice or medication? Does it go away? And because again, when you're running, you're actually, you're traumatizing your body. I mean, your muscles have microscopic, tears, and your body can certainly deal with that and build it up and become better after that. But like I said, if you're not giving yourself the chance to recuperate, then those pains are going to linger, and then that's when you would want to be a little more concerned.
Good to know. We have a question right now from Tyler.
Yes.
What's the question?
Are there any types of food or vitamins that can help with joint pain?
Good question, T.
So in general, I think most of us who have a normal 2,000 calorie diet are going to get pretty much everything you need. There's a lot out there about substances like chondroitin sulfate in terms of maintaining your joints, preventing breakdown, and while those medications don't necessarily have scientific studies backing them in terms of their effectiveness, they can be helpful. And for somebody who's experiencing joint pain, I think that's a reasonable option to consider.
And on that same note of nutrition, if somebody is preparing for something like a marathon, do you think that they should consult with a doctor as far as their nutritional plan? Because do they need more calories if they're going to be running that much more?
Typically, like I said, if you're on a regular standard diet, you're probably okay. I mean, if you have any concerns, it certainly wouldn't help. Most primary care doctors these days will have access to a nutritionist to point you in that direction. And if you have any concerns, like I said, it's not going to do anything but help you. So I don't think it's necessary, but I don't think it's a bad idea at all.
And of course, always important to just eat healthy and make sure you're getting all of
The simple things.
the fruits and veggies into
Exactly.
your diet. All right, so moving right along, are there any telltale signs apart from pain? Like, say I have some trouble stretching. I'm noticing I can't really stretch as far as I could. Is there anything like that we should be aware of?
Yeah, I mean, again, pain though I think is the key, and whether or not that pain is controllable.
Right.
But if you feel like you could stretch to a certain extent and all of a sudden you're not able to do that, I mean, it definitely could be signs that you've gone past the point of just the normal physiology of the body and the body healing itself, and now that you have something in the way of a structural problem, something's torn. If it's in the calf or the heel, your Achilles tendon lives there, and ultimately that's often a very common injury that people have when running. So yeah, I mean, that's a good way to look at it.
So when do we know, okay, it's time to see a doctor?
So again, I think it just comes down to the pain. You've been working up to a goal, running a marathon, say, and you've followed your regimen, and all of a sudden, this pain develops in your knee. Okay, you've done the proper things with ice and medication, and the pain's still there. And now the pain isn't just there when you run, but the pain's there with everything you do. It bothers you when you get up out of bed. Simple things like going up and down the stairs. You notice your knees bothering you. That's when it's probably best to see somebody and to figure out, is there something very worrisome there or not, and how can we get past this.
And of course, we want to avoid surgery if we can. Is something like physical therapy recommended for people who aren't quite there yet, but still, need that extra strengthening and that extra support?
Yeah, absolutely. Typically, running injuries most of the time are going to be overuse injuries, and physical therapy is tremendously helpful with those types of things. Oftentimes, they're not structural things where something needs to be repaired or fixed. So the therapists are well versed in exercises to stretch and strengthen, and ultimately they have a lot of modalities that they can use, things like ultrasound and electrical stimulation, and they can really get you back on the right track. And for most of the things we see in orthopedics, even things that aren't specific to running or sports, physical therapy is a tremendous value to us in terms of treatment, and oftentimes that's one of the first things that we suggest to people. Sometimes people can question it or be frustrated by it because it's a process. I mean, we tell you, you want to go to the therapist twice a week for 4 to 6 weeks, and that seems like a lot. And the reality of it is that if it didn't work, we wouldn't suggest it, and physical therapists, wouldn't be around. But it does work. We can't say it's going to work for everybody, but it's the mainstay of conservative treatment in the world of orthopedics.
Sure. Certainly worked for me.
Yeah. So we have another question from Greg. So Greg, what impact does treadmill running have? Do they cause more injuries, doctor?
Interesting.
So yeah, I mean, treadmills are very high impact, okay? And they tend to put a lot of stress on your knees. So especially what people like to do is they like to put that treadmill up on an incline. And what we know is that when you're going up and down steps or you're going up and down an incline, the kneecap specifically will see a pressure that's roughly equal to 3 times your body weight.
Ooh,
So,
wow.
you're really putting a tremendous amount of stress on there beyond just what the normal stress would be if you were running on, say, a track at a local park or at a school where it's got a little bit of cushion to it. So, treadmills are very commonly used, and they certainly are fine for the most part, but I think in general they can be a little more troublesome than if you're running in a different scenario.
That makes sense.
Kind of on the same front. So when I ran, my coach always encouraged us to run on the grass as opposed to the asphalt. Is that
Yeah.
for similar reasons?
Yeah,
just the
absolutely,
pressure?
exactly. I mean, and it's the same thing. Well, why would you play football on the grass, and why people have kind of started playing more on artificial turf that's now great and cushiony, because exactly that you're that ground or that turf or whatever is going to absorb some of that force when your foot's pounding, and so absolutely it's the same general concept.
It makes sense. Like if I go running outside, just randomly, I'm like, oh my gosh, I start feeling pain because that's not really something that you should do.
Yeah, I always run
on
on
the track.
the thin little grass strips
Yeah.
on the side of the
Yeah.
sidewalk. So speaking of running, I'm going to ask a question about shoes now, because shoes are very important, not just because they're cute and we like them, but because they give us a lot of support. How important is it to have a good supportive shoe?
I mean, it's almost as important as anything we've talked about. Ultimately, depending on the way that you're put together, if you have a little bit of a flat arch or what we call pronate your feet, and you don't have a shoe that's got good arch support, you're just going to run into problems. Ultimately, when you have that flat foot or that pronated foot, the pressure is just going to come up your shin bone, and that's where lots of muscles attach, and they're going to be just at higher risk. And it's all about trying to get what you want out of running and minimize the chance of running into problems. And so, like I said, without a doubt, shoes are vitally important, the right kind of shoe. There's lots of great running shoe stores around the area, and the people that work there have tremendous knowledge and different resources at their disposal to figure out what the right kind of shoes are for each individual. And if somebody's really interested in getting into a running program, possibly progressing to a marathon or half marathon, I think that would be well, it'd be great, appropriate for you to go to get an evaluation like that. And just the other thing too is you might have a pair of running shoes, and running shoes are like anything. I mean, they don't last forever,
Right.
and so you don't want to continue to rely on a pair of shoes that might be worn out. So, but like I said, big picture, shoes are important, just like everything else we've talked about.
Come prepared.
It
Even
is,
something
yeah.
as simple as staying hydrated
Yes.
is so important. And
Yeah.
a lot of people don't do that.
Yeah, I always see people running with water bottles. They have the belts that have the cute little things. Do you think that's necessary, or is it enough to just, drink some water beforehand and then hydrate afterwards?
I think you're probably fine to do the before and after. But yeah, you're right though. In general, hydration is key, especially in the summer months when it's humid and the sweat doesn't evaporate. You can run into problems, and you got to be very cognizant of that. And especially when the temperature gets higher and the humidity gets higher, those honestly, there might be a point where you want to say, maybe today's just not the day, or you got to do it really early in the morning or in the evening.
Let's
And
talk about that, the certain times that you recommend for runners. to go
yeah,
out.
again, I think at this time of year, it's early morning, evening. Okay, you want to don't be at that peak high temperature of the day.
Please
Getting
don't, guys.
toasty out there.
Because ultimately, your body has an ability to control its temperature, but it only is to a certain point. And if you're out there and it's 95 degrees, then that's when your body's less likely to be able to compensate, and ultimately you can get into big trouble. If your body can't regulate its temperature and that temperature climbs, you can get into dangerous areas, heat exhaustion, heat stroke, or terms that people have heard. They're in the news a lot with athletes, and there can be a point of no return there. So you just, like I said, you want to be smart about it.
And we have a question that just came in. Who is this question from? Let's take a look.
James.
Hey, James. He asks, what's a better treatment for arthritis and ankle swelling, cold or heat?
Good question.
Yeah, it is a good question, and kind of like we touched a little bit on the stretching before. The reality of it is there's not a right or wrong answer. You might talk to 10 different people and get 10 different answers. The way I look at it, if you're talking about acute pain, pain that comes from an injury or after running, Okay, I think your best bet there is the ice, because what the ice does that the heat doesn't do, it constricts your blood vessels, and ultimately that's going to diminish the swelling, and ultimately that's going to lessen the pain. If you're talking about a more chronic condition like arthritis, my experience is that heat tends to be a little more effective there. But I always tell my patients, I say, you know, if you have had experience using ice for arthritis and you found it to be helpful, then by all means keep doing that. Neither one is going to cause a problem. So you might, you know, experiment on your own. But, you know, I say in general, the ice for the acute injury, the heat for the more chronic, but, you know, find your own path.
Remember, we love hearing from you. Please send us your questions, and thank you to all of you who have sent us questions. We love answering them. We're hoping that you can learn a lot
And
through
I'm
this.
learning so much.
I am too. I'm going to apply a lot
so
of things
informative.
that we're talking about today to my running experiences. So I want to go back to temperature for just a second and focus on humidity, because we live in a part of the country that is very humid, especially throughout the summer. How does that affect our running? Does it go along the same lines? Just keep it in morning and evening to avoid that high humidity? What are the effects of that?
So what the humidity issue is all about, again, your body's ability to regulate temperature. One of the main ways our body regulates temperature is through sweat. Okay, so when it's humid out and you're sweating, that sweat just is not evaporating the same as it would in cool, dry air. So then that affects your body's ability to maintain its temperature. And the other thing is, you know, the air you're breathing in, when it's that hot, sticky air, it just doesn't flow the same. And then ultimately that's more likely to lead to pulmonary issues. So, you know, like I said, you got to be careful in the heat, but especially when it's heat plus humidity. And typically the early part of the day or the later part of the day, one of those two, heat or humidity, is going to be less, if not both of them. And you're just going to be less likely to run into a problem. And just following up with that, as it's hot and your body's controlling its temperature with the perspiration, again, you just got to pay attention to your hydration level.
So how about those cooler months when it's
We're getting
super,
there slowly.
right? Freezing outside.
Yeah, in
Winter
general, that's the best time. I mean, you just got to be a little bit careful. If you have conditions like asthma, sometimes those temperatures can cause spasm in your airways and ultimately lead to problems. You know, that's a little beyond, you know, my area of expertise, quite honestly. So, you know, people that have those issues, if they treat with a pulmonologist, it might be best that they talk to them about that and get their opinion on that too.
Yeah, and if you do have asthma, of course, keep your inhaler with you.
Yeah.
I know that's something that I have to be aware of because the heat and humidity can get to me. So I always make sure that I have that. I'll keep some water on me because cold water definitely helps me to be able to breathe a little bit better. So
just being prepared
know
overall is
yourself.
so important, and
Yeah.
knowing your body, so important too.
Absolutely. Yeah, so let's keep talking. Is there anything that you see that's just a very, very common injury? I mean, apart from overuse, like, do we see a lot of twisted ankles? Is that something that's really common? How can we avoid those things?
Yeah, I mean, ultimately, most of the things I see are from overuse. And, you know, on any given day, it can be a knee, it can be an ankle, it can be a shoulder. And again, in terms of avoiding things, it's just being smart about it. You know, you don't want to go running when it's wet and you're more likely to slip. Things like that. You want to be, we talked about the stretching, we talked about the hydration. So, like I said, things can happen, and sometimes those things are just, you know, beyond your control. But in general, I think a lot of it is just, you know, common sense type of thing. And you think, if you think to yourself, maybe today's not the best day to do that, you probably in general should, you know, follow your instincts on that.
And I noticed that some runners actually run with like little weights on their ankles.
Yeah.
Is that something that you recommend or
Yeah, I mean, I think,
avoid?
I'd be honest with you, I don't know that I would strongly recommend it. I don't think it's anything that's dangerous, but I don't know that there's any real science behind it in terms of how does that help you from a physiologic standpoint. So, you know, like I said, to me, I can't recommend doing it, but I don't think it's going to cause any problem either if it's something that you already do.
Gotcha. Balance.
Yes.
I feel like that's just the overall
Definitely.
vibe today. And we have another question from Tyler. What's up, Tyler?
So, do compression sleeves or socks make a big difference with running?
Yeah, so I think that they probably make a little difference. I mean, they are going to help if you are somebody that has a predisposition to swelling. Sometimes that can happen with folks that have high blood pressure or vascular insufficiency. I think, for the vast majority of us, it probably honestly doesn't make a huge difference. But in those people who would be more prone to that, it can certainly help prevent excess swelling that might lead to problems down the road. So I think in a subset of the population, it's a reasonable thing. But for most of us, it's probably not going to make a huge difference.
Gotcha. Maybe unless you already have shin splints and you
Yeah.
just want to keep everything
Sure.
compressed and together.
Yeah.
And if you have shin splints, should you continue to run, or you should just walk instead? What do you
I
recommend?
would
with
say if somebody diagnoses you with shin splints, typically you're probably best served with a period of rest more than what you would build into your normal routine. When we talk about shin splints, basically what we're talking about is irritation of where the muscle attaches to the bone. And it's just overworked. And if it's gotten to that point, then it's probably something that is going to continue to slow you down until you take a step back, give it enough time to heal. So in general, I think when you get to that point, you need to consider a more extended period of time of rest, somewhere in the order of 2 to 4 weeks.
And then slowly work your way back up. Maybe
Yeah.
start with swimming and then
Sure.
get to the elliptical.
Yeah,
And
exactly.
then start jogging.
Little walk.
Yeah, slowly, one step at a time.
Literally.
So I've read, and I don't know how true this is, that when you're running, like say in the city, you're breathing in a lot of air pollution, and it could actually be negatively affecting your health. Whereas if you're running, in a wooded area, it's going to be better for you. How true is that? Do you know anything about that?
I'll be honest with you, I'm not sure that you can really separate the two. I mean, I think it
Gotcha.
makes intuitive sense what you're saying, but I can't. I'm not aware of anybody who's actually looked at that from a scientific standpoint and found any difference between the two.
I always think about it when I'm running next to a road. I'm like, oh, should I be breathing
But
this
it
air
makes
right
a
now?
difference. Like if you're in the country or even in the county, it's like, oh, the air's different. Because I live in the city, and when I go in the county, I could feel a difference.
And I just like the scenery,
Yeah.
having all the greenness
It's an
around
energy
me.
thing.
It is.
Okay, doctor, any tips that our viewers should know? Last minute.
Anything we
words?
haven't gotten to
I
touch
mean, I
on?
think we've covered the major issues. I mean, you want to be sure and stretch. You want to be sure and be hydrated.
Stretch, hydrate.
You want to have a specific program if you're gearing up for something like a marathon in terms of days off. You want to make sure that you incorporate cross training into your routine, and then you just want to be aware of the issue that might suggest that there's something troublesome going on that would get you to be seen by a doctor.
Okay. Taking all the notes right now.
I know,
Speaking of
I
notes, we
know.
have another question from
Yes.
Shelly.
What's up, Shelly? Let me take just a second. Oh, we're going to come back to Shelly.
come back to
we know
Shelly.
you made a comment. We're going to get to you, Shelly, I promise. So before we get to Shelly's point, we know that you do have a new location. Tell us
That's
about
exciting.
Yeah, so our practice recently moved from the Physicians Pavilion East to the Physicians Pavilion West. It's a project that we've been working on for a while. We expanded our space, and now it allows us to see patients more efficiently. It's a brand new state-of-the-art office. It's on the 7th floor, Suite 705 in the, like you
nice.
said, the West Pavilion. And we're actually taking walk-in patients every morning from 8 to 10 for, basically acute injuries, something new that happened, and you need kind of a rapid diagnosis or evaluation or imaging or something like that. We do X-rays on site.
Such a good resource.
Yeah, but our old office was we had outgrown it. There wasn't enough room, and it was very inefficient, and we couldn't get patients in and out. But we've been in our new office now since about the beginning of May, and we're all having a real good time with it, and really happy that it's helping us to take better care of patients.
Absolutely.
Fantastic.
Yeah, those walk-in hours are great.
Yeah.
All right, we are going to get to you right now, Shelly. Let's see what she's asking us. All right, so Shelly says her son runs seasonally for football. Is he doing harm to his knees by not running during the off seasons? Thanks, Shelly.
I would say absolutely not. I mean, we have evolved in our society in terms of youth sports to the point where kids are doing things year round. Kids are doing the same thing year round, and most of us think that that's probably not a great thing. I mean, aside from running, we probably see this most in youth baseball. When I grew up in the 80s, you played some pickup baseball with your friends in the summer. Baseball season was spring to summer, and then you didn't really play baseball year round. But now it is a year round thing, and so kids are they're putting stress on their bodies in the same way the entire calendar year. They're not giving their shoulder and their elbow a rest. And we're seeing this huge increase in kids that are having ligamentous issues with their elbows as a result. So, time off from an activity is considered to be a good thing. And so in terms of Shelly's son running and getting away from that for a period of time, I think that's a good thing.
Yes.
All
We
right,
live in a
good
society
advice.
where everything's just always on the go, and it's so important to take time off
Right.
and have balance. We
Yeah,
forget that.
Especially since
Yeah.
sports teams at colleges now are looking at like middle schoolers
Right.
to start recruiting. There's a lot of pressure, but we have to remember to take it easy and
Yes.
rest. And
Yeah.
they're kids.
Yeah.
Yeah.
At
They
the end
are.
of the day.
For sure.
Well, we've so appreciated having you. Is there a website where we can go to learn more, or how can we reach out if we want
so
appointments?
gbmc.org. You can find us there. Office phone number is 443-849-3838. Those are probably the two best ways to do it.
Okay, and
And
we
we
have
have
one last comment.
out on Tanya's comment.
Dun. Last but not least. There we go.
So Tanya says, I had a whole ankle replacement
Whoa.
and my doctor is the best.
Aw,
#GBMC.
I love it.
That's great, Tanya. We're so happy to hear that you had such a good experience.
Appreciate the
Did not
love.
know a whole ankle replacement was a thing.
Yeah, so we're fortunate. We have a doctor in our practice, Dr. Steve Kulik. He's an orthopedic surgeon like me, but he specializes in the foot and ankle. That's all he does. And I'm sure that's who Tanya's talking about. He's one of the guys in the area that does ankle replacements. They're not as common as knee replacements or hip replacements because the ankle is just not a joint that is afflicted by arthritis in the same way. But for the right person, they can be a life changer, and he does a great job.
It's good to know. We appreciate the love.
we do.
Well,
Thank you,
you so
Tanya.
much, Doctor. Appreciate
really
chatting
appreciate
with you.
My pleasure. Thanks for
Yeah.
having me.
We've learned a lot. Check that website if you want to learn more. And thank you so much for tuning in.
See you guys soon.
Bye. Everyone.